Can imaging like MRI and X-rays differentiate arthritis types? Imagine trying to solve a puzzle where each piece is a different part of your joint. Medical imaging tools like magnetic resonance imaging and X-ray scans are like the puzzle pieces that help doctors see what's happening inside your joints. These images can reveal different patterns of damage and inflammation that are unique to each type of arthritis. X-ray images are often the first step in diagnosing arthritis because they are quick, affordable, and good at showing bone changes. For osteoarthritis, X-rays typically show joint space narrowing because of cartilage loss. You might also see bone spurs, which are bony growths, and increased bone density under the cartilage called subchondral sclerosis. Sometimes, small cysts form inside the bone. These signs point to the wear and tear nature of osteoarthritis. In contrast, rheumatoid arthritis X-rays often reveal symmetrical joint space narrowing, meaning both sides of a joint are affected equally. You may notice bone erosions at the edges of the joint where cartilage is missing, and the bones near the joint may have reduced density, a condition called periarticular osteopenia. These features reflected the inflammation and immune system attack that characterize rheumatoid arthritis. However, early in the disease process, X-ray images might look normal because significant bone damage hasn't yet appeared. That is where magnetic resonance imaging comes into play. MRI scans provide a much more detailed picture of both bones and soft tissues like cartilage, ligaments, and the synovial membrane, which lines the joint. In rheumatoid arthritis, MRI often shows inflammation of the synovium, called synovitis, which appears as swelling and thickening. It can also detect bone marrow edema, which is fluid buildup inside the bone, and early erosions before they are visible on X-rays. Cartilage destruction and soft tissue swelling are also visible, helping doctors see the full extent of the inflammation. For osteoarthritis, MRI reveals cartilage thinning, loss, and the formation of osteophytes or bone spurs. It can also show changes in the subchondral bone, such as sclerosis and cysts, along with joint fluid buildup called effusion. While inflammation may be present, it is usually less prominent than in inflammatory arthritis. In psoriatic arthritis, MRI findings include thickening of tendons and ligaments, joint effusions, and erosions. Sometimes, new bone formation occurs at the entheses, the points where tendons and ligaments attach to bone, which is different from what you see in rheumatoid arthritis or osteoarthritis. Because MRI can detect inflammation and soft tissue changes early, it helps distinguish inflammatory types of arthritis from degenerative ones before significant bone damage occurs. Combining MRI results with blood tests and clinical signs makes diagnosis more accurate. So, while X-rays are great for seeing the damage that has already happened, MRI gives a clearer picture of what's going on inside the joint at an earlier stage. This helps doctors identify the specific type of arthritis and plan the best treatment.